Welcome to Life Sutras, where we have empowering conversations with thought leaders that will inspire you to be a healthier and happier version of yourself. We will explore science, the subconscious, as well as the spiritual. Good health equals harmony between many dimensions of mind, body, environment, and the unknown.
Now, the second thing about the treatment, the different medication that's out there, the shortage that's out there, how do we go about that situation? Like remdesivir was one.
Yes, there's also, before I touch remdesivir, the antibiotics, role of antibiotics, when to start steroids. Now, steroids has a specific indication. It's a wonder drug. It's a life-saving. It has been shown to decrease mortality. And the indication of steroids is that if a patient, there can be different scenarios, please check with your physician. Steroids, patient with COVID-19 infection who has these symptoms and perhaps his CT scan might be showing some ground glass opacities and his oxygen saturation is going below 92%. Actually, that is the recommendations and guidelines. But you know, there are still, we use differently. Somebody is using steroids even if it goes below 94%. So that's okay. So don't use steroids when your oxygen saturation is 98% and your imaging studies is showing pneumonia. So use that. This is what has been studied, and this is the recommendations that use steroids only if your oxygen saturation drops 92%, but you can just keep a window of below 94% as well. Second is the role of antibiotics. You know, if you belong to mild and moderate, perhaps you don't need antibiotics. Antibiotics, you know, is but natural, that is a viral infection. Why do we use antibiotics? Now, the studies have shown that we see the example from influenza, the flu. Most of the deaths are because of the superadded bacterial infections. And we are pretty sure that many of the patients of COVID infection might be having a superadded bacterial infections. But again, we use antibiotics in a hospital setup where the patient is more sick. So there is no added advantage of using antibiotics when the patient belongs to with minor or moderate symptoms. Maybe some selected cases of moderate symptoms can have antibiotics. What I'm trying to say that by and large, you don't need steroids, you don't need antibiotics, provided unless you meet some criteria.
A lot of times you get hospital-acquired infections as well, and that's one of the reasons why they give you antibiotics in a hospital setting. So if you're isolated and you're fine at home, you don't need to start medication, because I'm seeing there's an urgency, oh, I've got COVID, I need to start medication.
Right. I would like to make a small correction here. When we talk in terms of viral, say for example, we are talking about influenza, that's also a viral disease. But the most mortality of influenza is because of superadded bacterial infection.
And you can get it at home as well?
No, not at home. These are selected for selective sick patients who are in the hospital, who have other markers and other things that qualify. But by and large, there is a proper indication of starting antibiotics. And we also think that there are a lot of superadded infection with COVID-19 pneumonia as well. So we are using, but it is for the sick patients, sick and critical patients that we are using. But selectively, some portion of the moderate symptoms, we can use it. But what I'm trying to say that it doesn't have any role in random, that you have COVID-19, you start antibiotics, you start steroids. So that is what I'm trying to clarify. There are certain special situations like remdesivir, convalescent plasma, and the monoclonal antibody tocilizumab that is being used. But for the information of general public, you know, these medicines are for select patients with select indications. Again, it's not that you have COVID and now this remdesivir is a magic drug, or convalescent plasma is a magic drug, or tocilizumab is a magic drug that we need to go around. I'm saying this with reference that there has been a lot of hoarding, lot of shortages of remdesivir, and a lot of volunteers are running around. My patient is sick, I need a plasma donor, I need a plasma donor. So remdesivir has been used in select patients who are severely sick, and there is a small window. We try to use remdesivir. It has not shown any benefit over the mortality, but it is being used because there are still some studies that are still going on, but there is a narrow window where we use it, and in those windows we need to use in a very timely fashion.
Right.
Same is the case with convalescent plasma. Maybe you may get upset, but because I can understand your situation, because your loved one has COVID, he is sick, and you want to do everything possible so that you don't have any feeling of guilt. But you need to understand that we practice evidence-based medicine. And convalescent plasma again is also meant for certain section of COVID-19 infection who are in the hospital, not at home. Similarly, tocilizumab, monoclonal antibody for sicker patients, not for everyone to take. So that is about the medications.
What about you in your ER? Like, what are some of the general protocols? Is there like a blanket protocol you follow for every patient? Because in India, I feel that's what's happening. Everybody gets on Faviflu, Tamiflu, they get on some Doxy something. They share their prescriptions. Oh, you have COVID? Here, take my prescription. Start the medication.
Yeah, absolutely not. There is no blanket protocol. In fact, I would be inclined to say that probably most of my patients, I do nothing. I tell them go home, take over-the-counter medications like ibuprofen and Tylenol to bring down your fevers and give you some symptomatic relief of your symptoms. But most of the patients that come to the ER are not in need of anything more than just that. And I also, just tying back to what you were talking about, Dr. Kaul, about the steroids and the antibiotics, is that none of these medications are completely harmless. I mean, I think that's the other thing that it's really important for our listeners to understand, is that steroids and antibiotics and remdesivir and all of these monoclonal antibodies are not benign medications. Meaning, if you take them when you don't need to take them, you can actually be harming your body. And I think that's a really critical thing for people to really understand and absorb. Because I'll give you a simple example of an unnecessary antibiotic really impacts our gut microbiome. And a large part of our immune system lives in our gut. And so we're essentially compromising our immunity by taking antibiotics unnecessarily. So I would urge all of our listeners and everybody to only take antibiotics as directed by your physician. Don't take a family member's medication. Don't run out and try to get a medication without proper medical direction.
I may add, with your permission, we said that the physicians in India are following different protocols. I want to set the message right. Indian physicians are one of the best physicians. They are very smart physicians. It is the nature of the disease. At one stage, because this is a new disease and studies are still going on, every country might be having some different protocols here and there, and same is true with India as well. I remember that when we were in the middle of the crisis and in the beginning, there was a lot of hype about the role of chloroquine. And everybody saying, why don't you give me chloroquine? It is for prophylaxis. But it becomes an issue, because evidence-based is something different than creating a hype about a medicine which doesn't fulfill that criteria. Similarly, there are certain situations where in India they use ivermectin, they use other medications. At this stage, as a physician, maybe the studies show later on that they may work. But as of now, there is no significant, there is no guidelines to use them. But that doesn't mean in any case that the physicians in India are not smart. They are very smart people.
No, the physicians are smart. Patients share their own prescriptions. So in India, I can take my sister's prescription and go and get medication, and I start taking the medication without consulting a doctor. So that happens very often, where you don't see a prescription, you say, okay, my aunt got it, I'll start taking the same medications as her.
Yeah, I wanted to clarify so that a wrong message doesn't go.
No. Our physicians are working tirelessly. They are doing their best, I know. But very often we don't seek a consultation and we just go and jump in and start following, oh, I'll follow your prescription.
And that happens here too. I mean, it happens in the US all the time.
Here it's harder to get medication.
Yeah.
In India it's a little easier to get medication
Yeah.
because it's not centralized medical records. Can we now talk a little bit about, again, understanding what is this variant? What's going on? What is this mutation? Is there going to be a third wave? Dr. Latib, can you shed some light on that, please?
Yeah, absolutely. So viruses mutate all the time. It's a natural part of evolutionary biology, right? And when viruses mutate, sometimes they become weaker and sometimes they become stronger. And if they become stronger, it essentially means that they can proliferate faster and perhaps cause infections at variable rates. And I think the biggest thing that is going on are people are getting very frightened about these mutations. And the reality is that this virus is never going to stop mutating. And that is just a fact of reality, right? I mean, the flu virus mutates every year. That's why we all get vaccinated with a flu shot every year, because it changes. And so essentially when we're creating these vaccines, the CDC is basically making a prediction of what strains are potentially going to be the most impactful in a given year, and they create the vaccine based on that information. My hypothesis is that that is probably the direction that we're heading with COVID, and that this is going to just be a part of our life. But hopefully it will get to the point where it's well controlled, just like the flu is controlled. So this new variant, which is called the B1617, the thing about it, which is the Indian variant, is that it's basically a double mutant. Okay, and there's two different mutations. The first mutation is very similar to the mutation that was found in the UK, the South African, and the Brazilian variant. The second mutation was actually the one that was first seen in California. And let me make a little correction. That first mutation is similar to the one that we saw in South Africa, Brazil, and in the UK. Not exactly the same. But essentially, the first mutation is actually is what we call an escape mutation, and that is why this is causing such havoc in India. And they use that terminology to describe a mutation or a type of virus that can essentially escape the immune system, so that when people are infected, the virus has a way of sort of dampening our immune response. And that is the reason that this is such a frightening strain, and that is the reason that the rates are so astronomical. I mean, India has set a global record, right? I mean, they've been on, I think, on now a 6 or 7 day streak, and yesterday was the highest, 361,000 new infections, and I think about 200,000 people have died. So it's quite frightening. But
these are very, very conservative numbers.
Yes,
From what I'm
exactly.
hearing is the number could be 15 to 20 times
yes,
the numbers that are being reported.
Exactly. But the good news is that there was a neutralization study that was done in India that does show that the current vaccines that we have are effective against this variant. Obviously, India is a little bit behind the US in terms of vaccine administration, and I think that is what, for me personally, is so frightening, because right now India is only administering about 2.2 million doses per day, which means that by the end of the year, only 30% of the population is potentially going to be vaccinated. And in order to vaccinate the entire population of India, we would have to increase our vaccination doses to 100 million a day, which is, an insurmountable task, in my opinion, based on the availability of the vaccine. And the vaccines that, of course, are in India are different than the ones that we have here. And one of them is an AstraZeneca vaccine, and then there's another one as well. I think the take home here is that there are so many things that we can do to impact and optimize our health, given the current crisis. We've already talked about a lot of them. We've talked about the importance of movement. We've talked about the importance of meditation and relaxation techniques, which will increase your immune response and enable you to, one, hopefully not get COVID, and two, if you get it, put you in a position where your body is innately able to fight it on its own. Sleep is another huge one that I feel is very commonly overlooked. When people are in panic or maybe taking care of loved ones, the last thing you do is think about yourself, right? And so you end up compromising your own health by not taking care of yourself. But the reality is that you can't take care of anyone you love if you're not taking care of yourself. So sleep is probably one of my #1 recommendations, because at night when we are sleeping is when our body heals. It's when our body is going around, and think of your body as having little trash trucks and going around and collecting debris and collecting free radicals, which are damaging molecules that are both produced by our body as well as being exposed in our environment and put into our body in the form of food, right? If we're not eating proper, clean, healthy, nutritious food. And so our body has these trash trucks that essentially go around at night and collect all this debris, collect all these bad things, and and our liver takes a fat-soluble toxin, turns it into a water-soluble toxin that we are then able to eliminate. And a lot of this happens at night when we're sleeping. So if we're not getting, my recommendation is 7 to 9 hours of sleep as a minimum. I think honestly 8 hours is a minimum, 8 to 9 hours of uninterrupted, high-quality sleep. How do you do that? There's a lot of different tips and tricks. One is no blue light, meaning no screen, no phone 2 hours before bedtime. If you have to do it, just as you can get a pulse oximeter for $20 online, very readily available, you can get blue light glasses that are also 10 to 20 bucks, and that will block blue light. Blue light is a problem because it interferes with our circadian rhythm, and it will make it very difficult for us to get into our deepest sleep cycles. Also refraining from eating 3 hours before bedtime. And it's really important also to go to bed and wake up at the same time every day, because our bodies love habit. And so sleep is another really, really important aspect of self-care. Nutrition is really, really important, right? So there's lots of superfoods that we can eat. That are going to empower our immune system. Things like, one of the most common Indian spices is turmeric, and it's amazing for your immune system. So, put a little extra turmeric. Garlic is another healing food. And lots of nutrient-dense foods like dark leafy vegetables, cruciferous vegetables. One of the supplements actually that has been studied to decrease viral replication in the case of COVID is sulforaphane. And you don't have to go out and find sulforaphane. All you have to do is eat cruciferous vegetables. If you eat things like, cauliflower and broccoli, those are all cruciferous vegetables that you can naturally boost your immunity.
What about supplements? Like people are just overloading on zinc and vitamin C. What are your recommendations around that?
Yeah, so supplements I think are great, because supplements are you can fall back on them. But the reality is everything in these supplements is found in food. So if you are eating a nutrient-dense diet, if you're eating a balanced mix of fruits and vegetables and lean protein from good sources, then you're probably going to be quite all right. Vitamin C and vitamin D are probably two of the most highly studied supplements that really do enhance our immune system and have a clinically proven role in helping with COVID. Zinc is another big one that people are commonly taking that actually works quite well. And then there's a lot of other ones that people don't think about. EGCG, for instance, is an antioxidant that is in green tea. And you can get the same amount of green tea that you would find in a supplement just by drinking like 2 or 3 cups of brewed green tea in a day. So there's a lot of ways that we can do this naturally. One of the other things I forgot to add about turmeric is that the active molecule in turmeric that boosts immunity is actually exponentially elevated in terms of its bioavailability and efficacy if black pepper is added. So make sure whenever you're cooking something with turmeric, and this is not hard to ask in India, make sure you add a little pepper, because black pepper enhances the bioavailability of the active molecule in curcumin or turmeric that is healing.
Yeah,
Great.
it's a nice knowledge.
Yeah. Well, thank you so much. I think today's episode has been very beneficial because it makes us stop and think, what am I doing to take care of myself? How can I take better care of our loved one. And very importantly, don't isolate them so badly. You can go near a loved one. You can protect yourself. I mean, can you also tell us a little bit about how to derobe, or how do you approach, how can you take care of a loved one and physically not, isolate?
Absolutely.
That's the important aspect.
Absolutely. And that's also that's a great point. It's very well studied in the literature that social interaction causes a biochemical change in our body and is essential to healing. That's the reason that communities are so emphasized in various cultures, and especially in our Indian culture, right? Community is such a big part of who we are. And so I agree. I mean, we cannot isolate, because isolation is a sure way to a downward spiral. We have to stay together, but we have to be safe when we do that. So, definitely a mask, and if you're concerned about, is your mask good enough, wear a double mask. I mean,
so if I'm going and taking care of a sick patient,
yeah,
I wear an N95 mask. Is that the first choice?
You don't have to wear an N95 mask, right?
Yeah, the recommendation is that, this COVID-19 has a huge social implications. We have parents living in the same household, and say, for example, parents are having their elderly, their 80-year-old, they need social interactions, and let us say that somebody gets COVID, so he needs to be isolated. So what is happening is that now their isolation, they are just left for themselves. Not that I mean to say this is the nature of the disease, but there are ways that you can approach the patient, but you have to maintain highest level of precautions. And what are those? Like we do in the hospitals, we go very close to the patients. We wear a gown. It's a plastic gown. Wear a surgical mask. I would recommend wear a double surgical mask. If you have N95, this is the N95 that I'm wearing. This is N95. It gives some little difficulty in breathing by itself because it's a little tight. So if you have an N95, that's definitely good. This is the best prevention. But if you do not, use double surgical mask. But what is more important is to wear a face shield. This is a barrier, because this is a droplet infection and it spreads if somebody coughs. So these droplets goes into your mucosa and cause the cascading effect of inflammation. So wear a face shield, wear gloves. You can go close to him, close to the patient, close to the elderly where they
Can
need
we
help.
go and give them a little bit of pulmonary rehab?
Absolutely,
Because that's
we
the other
do
thing
that.
we didn't talk about is avoiding a downward spiral and landing up in the ICU.
Yes. That is the way we have been dealing, and that is nothing else I am doing, at least to take care of my patients. The only thing, this addition is N95, and on top of that is a face shield, and I put a gown. And then when I leave the patient, then we need to disrobe it in a proper way, and then wash your hands, wash your use sanitizers, wash your stethoscope, whatever is exposed. That is very, very important. One more thing I would like to say, that we do talk about surgical masks, N95. Do you know simple things like hand washing? Hand washing has shown, with simple soap, if you don't have a sanitizer, hand washing has shown very good results in preventing, because you need to be very careful about this area, your eyes, your nose, your mouth. This is the entry. This virus outside the human body, outside the respiratory system, is nothing. It will be killed in just 5 seconds if we use the sanitizers we use. But the sanitizers that have isopropyl alcohol above 70%, that is recommended for use. And that is perhaps, if we do these measures, we are definitely going to take a significant step in protecting ourselves.
So with disrobing, you were saying there's a special step 1, 2, 3. Can you highlight that,
Yeah,
please?
absolutely. So I mean, if you are wearing a face shield, masks, gloves, and a gown, you want to disrobe in the right order. And you want to make sure that you are putting it on a surface which eventually you will disinfect. When I disrobe, the first thing I do is, take off my my face shield, and I'll put it down. The mask is the last thing that comes off. You want to keep your mask on till the very end. And in between taking things off, even with your gloves on, use hand sanitizer. So take off your face shield, put it down, hand sanitize. Take off your gown, make sure that you put the inside out and dispose of it, hand sanitize again. And then take off one mask, hand sanitize again, and then finally and then actually I would leave the last mask on until you finish cleaning whatever you need to clean, dispose of everything you want to get rid of, and then eventually when you're in a safe space, isolated and away from wherever you need from an infected person, then and in your house, hopefully, that's when you take off your last mask.
Well, thank you so much.
Can I add
yes,
some
please,
important
of
thing that I don't think we covered that. Certain section of the population needs definitely utmost care, because elderly 65 and above, those who are having COPD, chronic obstructive pulmonary disease, those having uncontrolled diabetes, those having underlying cancers, who are immunosuppressants, who are on immunosuppressant therapies, they need to be very, very cautious, and they need to follow highest level of precautions till this surge is going on. And what I would say, this surge is going to peak. The peak is yet to come. I'm not spreading the panic. I'm just telling you and alerting you that what to expect in coming days. And that is what has been going on for last 1 week, the numbers, the way it is going. So it demands a very highest level of precautions from all the citizens of the India, and especially the vulnerable sections of the population, that is elderly, with all the listed things I discussed, and basically using masking. Masks have shown, because it's a respiratory virus, so you need to wear mask, maintain social distancing, 6 feet at least. So these are the measures that everyone should practice. Stay outside the crowd, don't assemble, keep your rooms well ventilated, avoid crowding. So that is really very, very important. And this message, keeping in view the current scenario and expecting few days. Now, why I'm saying, can I take 2 more minutes?
Please take your time. This is an important message.
Yes. Now we see that the numbers are 350,000 today. Maybe, God forbid, it goes to 400,000. I mean, under this situation, it will happen. There is a science. These are all epidemiological studies. The unit of weight is either kilo or pound. We have a unit for checking the virulence of a contagion, and that is called as R0. So this is for those who are well educated, who are having scientific backgrounds. They can understand the unit of the virulence of a contagion is R0. So what does R0 mean? R0 means that any contagion, one person, how many can it infect in the vicinity, whosoever that person has the infection, how many can it spread the infection? The more the R0, the more the virulence of the disease. Now, the most dreaded infectious disease in old days was measles, and its R0 was somewhere around 15 to 18. So what it means? It means that one person of measles can spread the infection to 15 to 18 people in its vicinity, and see the cascade effect. And out of those 15 to 18, everyone will spread to 15 to 18. That's how you see the numbers are piling up, Similarly, with COVID-19, as of now, still the studies are going on. I don't know the latest number of the R0 in India currently, but apparently the studies have shown that R0 of COVID-19 is around 3.9. It's around 3.9. Maybe the numbers are higher than that, but that means R0 prepares the government, prepares all the policy makers how to anticipate the trajectory of the infection. So the R0, we want to keep it below 1. That means that it is contained. But once R0 keep on piling, going high, that means how contagious the disease is. So this, I wanted to give an added information what to expect in next few days, few months, because it's going to go up, then it will plateau, and then it will start dipping. So this is the trajectory of any pandemic. And in that process, as Dr. Latib said, that a virus can become more virulent, it may become more passive, it may change its shape, what we call as mutations. All these things can happen in this trajectory. So this is very important to understand the concept, so that you know what are the challenges and what to do next. That will be helpful.
Thank you, thank you. I'm sure this is one of many more that we would be doing in the coming future. Breathe Easy India and Breathe Easy USA have taken it upon ourselves to spread credible information out there, because there's a lot of myths, there's a lot of panic, and we want to alleviate that. We are also starting drives to donate oxygen cylinders. We are donating oxygen plants, because in the long term and the medium term, we need to strengthen the healthcare infrastructure in India, which is collapsing. And we have 50 plants going out in the next 4 or 5 weeks. Our team is working tirelessly with all the governments, with the Indian Army. There are more plants that are going to be available in 5, 6, 8 weeks from now, maybe 12 weeks from now, which is not such a grim situation in the long term. So please do reach out to Breathe Easy India or Breathe Easy USA if you want a plant donated to a charitable hospital or a government hospital, and we will start working on that project, because we want to strengthen India, we want to strengthen the infrastructure, and to the rest of the world, this mutation can even come here. So I'm hoping that everything we spoke about today is going to help us all, and let's keep reminding ourselves, step it up, just do what we can do, at least one person at a time. So thank you so much. I know you're busy physicians. Thank you for taking time out. This has been, I've learned a lot today, by the way. I mean, I've learned a lot, and we have a small audience here who's learned a lot, but we have a much larger audience that has, I think they're going to find it very, very helpful today. Thank you. Thank you so much.
Thanks for having us.
Thanks for having
Thank you so much. It's been a pleasure.